Sally Burrows. I'm a researcher at University of Essex, and I work in the applied research collaboration for the National Institute for Health Research. I've known for years about the discrimination and the inequality, that these communities experience.
Hi, I'm Ewan Speed. I'm a professor of medical sociology at the University of Essex, and I was the principal investigator on this research project. In terms of findings, we had three main findings that we found. Firstly, around issues of the need to raise awareness of Gypsy Roma traveller community members' rights and needs in terms of healthcare. Secondly, we found there was a very clear need to improve communication and understanding between Gypsy Roma traveller patients and healthcare professionals. And thirdly, there was a very clear need to agree reasonable adjustments, for example, around the length of a GP appointment within the research project. And we felt that, the key issue was really about raising the number of trusted practitioners, and that was critical to improving access to healthcare for these community members.
Yeah, so my name is Peter Torak. I am the CEO of a Compass charity. In what we predominantly help migrants from Central Eastern Europe. And why we help them with those sort of things, obviously, especially with literacy, is because the historical abuse and marginalization caused, or is obviously the cause for Roma not being always capable of understanding everything in the written form. And when they come here, so not only that, quite often they struggle with their home language, but often they also struggle with English, and also their digital skills are very low. So that's why I think this is a very important piece of work.
My name's Sherry Smith. I'm a Roman Gypsy. I'm CEO of Gypsies and Travels Essex and founder, and I'm also director and co-founder of Drive to Survive. I've been aware that there's been a problem with health, I suppose, ever since I was a child, really. I could see that people around me were ill. I didn't have any elderly relatives. There was issues there. And then I got an eating disorder about 10 years ago. And I started realising that the racism that I faced in hospitals and by paramedics and, front-facing staff like secretaries and receptionists.
So I'm Tanya Blumenfeld. I'm a GP, and I've worked with patients from the traveling community for many years. The research was concerning barriers to access. All British patients are allowed to register with a GP, and they don't need any paperwork to do this. I think it was also important to educate those staff at the desk, at the front line.
I'm Daniel. I am the Strategy Development Manager at Hertfordshire Partnership NHS Foundation Trust. I'm also the lead for Health Inequalities and Anchor Institutions. The work that's been done by Essex University really gave us the opportunity to really start to delve deeper into it and work collaboratively with people from the community and also with other system partners. So it's been very helpful. And a lot of the learning from that has been really useful in helping us to start to identify what we can do collectively to improve access, but also to standardize practices across the system.